For its epidemiology, its lifetime prevalence is 2 to 6%. So it can be the most disabling of phobias. So it can affect the patient and they may even refuse to leave the house due to this condition. So it almost always develops as a complication of panic disorder. So three-fourths of agoraphobic patients had panic disorder prior to its onset in a psychiatric setting, and in the community, about half of patients with agoraphobia had no panic disorder. So the DSM-5 classifies agoraphobia as a separate condition that may or may not be comorbid with panic disorder because of this. So its etymology came from the word agora and phobos, which means fear of the marketplace. So for its criteria, it is a marked fear or anxiety about two or more of the following 5 situations. So such as the use of public transport like bus, being in open spaces like parking lots, malls, parkings, marketplaces, bridges. So being in enclosed places like shops or theaters where they feel like it's impossible to escape, standing in line or being in a crowd or being outside of the home alone. So the individual fears or avoids these situations because of thoughts that escape might be difficult or may not be available in events of developing panic-like symptoms. So these situations mentioned in criterion A almost always provoke fear or anxiety. So, and these situations are actively avoided and require the presence of a companion or are induced sorry excuse me uh it or are endured with intense fear or anxiety. So the fear or anxiety experienced by patients with agoraphobia is out of proportion to the actual danger of the actual situation or sociocultural context. So it lasts usually for 6 months or more. And again, like any other mental health disorders, the symptoms, the distress caused by this fear and anxiety is uh, significant enough to cause distress and impairment for the patient. So, if another medical condition is present, the fear and anxiety or avoidance is clearly excessive. So, but these fears and anxiety or avoidance is better not explained by another mental health disorder. So, uh, there is an important note in the DSM-5 that agoraphobia is diagnosed irrespective of the presence of panic disorder. So, if an individual meets the criteria for panic, both disorders, both diagnoses should be assigned. So, for the treatment, benzodiazepine offers the most rapid onset. However, again, it has potential for dependence and abuse. So, SSRIs is used for better safety profile and less side effects. So, TCA and tetracyclic antidepressants like clomipramine and imipramine, they're also very effective. But titration is slow due to overstimulation and it has more side effects like it lowers seizure threshold and it has harmful cardiac side effects compared to SSRIs. That's why SSRIs are considered the first line. So just like generalized anxiety disorder, psychotherapy can also be given or offered to these patients, such as supportive psychotherapy, insight oriented psychotherapy, and cognitive therapy. Uh, all of these were already presented a while ago for generalized anxiety disorders. So, next for the anxiety disorders, we have specific phobia. So, comparing to generalized anxiety disorder, this specific phobia is excessive fear of a specific objects, circumstance, or situation. So 5 to 10% is prevalent in the US. So it is the most common mental health disorder in women, 14 to 16%, and second most common mental disorder in men, around 5 to 7. So there is a 1-to-1 ratio in blood injection injury, and it has a high comorbidity rate. So due to the specific phobia, it can be in coexistent or comorbids with anxiety disorders, mood disorders like depression, and substance-related disorders. Depression, which is a mood disorder, may be found in one-third of patients with phobia. So, due to the excessive fear that they experience due to their phobia, so sometimes they feel helpless, uh, which can lead to anxiety or depression. So there are different phobias identified. So you can just look it up, like fear of heights, fear of a specific animal. So you can look them up. So there are specific phobia types like animals, natural environments like storms, then blood injection injuries like needle. So, what is unique for blood injection injury phobias like in needles? So, bradycardia and hypotension often follows the initial tachycardia. That is common to all phobias. And also situational types like planes, elevators, and cars. So, uh, the most common of these phobias are animals, next are storms, heights, injury, and death. So, for its diagnostic criteria, so it is marked fear or anxiety about a specific object as compared to a generalized anxiety disorder. In children, it may be expressed in by crying, tantrums, freezing, or clinging. So, the phobic object or the situation almost always provokes immediate fear or anxiety. And the object is actively avoided or endured with intense fear or anxiety. And like agoraphobia, the fear or anxiety is out of proportion to the actual danger posed by the object or situation. So, it the fear and anxiety felt is lasts more than 6 months, and again causes significant impairment. So, it's not better explained by other disorders, and it has specifiers. So, uh, it, it is specified whether the phobia or the stimulus is whether due to an animal, natural environment, or an injury. So, for the treatment of specific phobia, the most studied and most effective is behavioral therapy. So, uh, the key aspects for a specific or successful behavioral therapy is the patient's commitment to treatment, a clearly identified problems or objectives, and available alternative strategies for coping with feelings. So techniques include systematic desensitization, image flooding, and flooding in vivo. So for the next disorder, social anxiety disorders, it includes fear of social situations that includes scrutiny or contact with strangers. So they fear of being embarrassed in social situation, and uh, the fear in uh, SAD is of the embarrassment that may occur and not the situation itself. So uh, it's not necessarily, for example, the presentation in front of a large crowd. It's more of the possible embarrassment that might happen during the performance itself and not the situation. So its prevalence is 3 to 13% of the population, and it is also comorbid with other disorders. So for the diagnostic criteria, so it is fear or anxiety about one or more social situations in which the individual is exposed to possible scrutiny or humiliation. So in children, it must occur in peer setting and not just interactions with adults. Then the individual fears that they will act in a way or show anxiety symptoms that will be negatively evaluated. So, for example, they're anticipating that they will be humiliating or embarrassing, that it will lead to rejection or offend others. So, the situation almost always provoke the fear and anxiety. So, in children, it may be expressed as tantrums, freezing, or failing to speak in social situations. So, just like phobia and uh, the situation is avoided or endured, and it is out of proportion to the actual threat. So duration is also at least 6 months. So also causes impairment not attributable to other conditions. Okay, so can be specified if it is only due to performance, if the fear is restricted to speaking or performing in public. So the first line for social anxiety is SSRIs. So other options are benzodiazepines, buspirone. Some may also benefit from monoamine oxidase inhibitors. So for performance type, propranolol is used. So psychotherapy, usually it's a combination of behavioral and cognitive methods. So it includes cognitive retraining, desensitization, rehearsals, and homework assignments. So that ends the lecture for anxiety disorders. So thank you for listening, and I hope the weather is getting better in your place. Okay, so I'll
Any question?
uh,
You guys have any questions for Dr. Tan? Feel free to unmute if you do. Okay, if none, thank you guys for coming. Tomorrow you'll have more lectures. Bye-bye.
Yung mayor bully. Ang mayor bully.
Mhm.